Are we up and running? Okay. We are going to call the meeting to order. It is Tuesday, March 19th, 2024. Please stand for the pledge.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
You're supposed to say born and unborn.
Born and then born. It was.
Okay. Do we have any minutes or reports received and filed?
Yes, we do. We have the treasurer's February 2024 reconciliation report, and we have the collector's February 2024 fees.
Commissioner Committee Liaison Reports, upcoming meetings and events.
Okay. Wednesday is Salute to America meeting. I think it's the first meeting we're going to have speaking with the city about the next round of the capital improvement sales tax, it's not till 26, but we're starting to talk about it already. And then I think Wednesday there's a Jefferson City Chamber Transportation Committee meeting.
Yes.
Thursday, a VTE meeting. And I'm going to attend a naturalization oath of allegiance event at the courthouse on Thursday afternoon. Friday, a Heartland Port meeting. That's what I have.
Okay. Yeah, transportation meeting tomorrow is at 7:30. And I have a meeting in City Hall at 3:15. Thursday is the Capital City Housing Conference, but it's from 9 to 3 p.m. I don't think I will make that. Friday, there is the City Council Candidate Forum, which I don't know. Saturday, I have a National Guard ESGR training class. I'm going to be at for a while. I've got the Sons of the Union Veterans meeting. And then Sunday is the Westphalia Historical Society, which is in Osage County, but, you know, and that is all I have. Yeah, that is all I have. Any commission comments? Bids and contracts. Unfinished business. Gosh. New business, accounts payable review.
I would ask you to approve accounts payable pending review. I am going to take both of yours out this time. I have two of you here.
Make a motion to approve accounts payable pending review.
Second. All in favor?
Aye.
Okay, second and final reading of budget adjustment number 4.
So I do need an action on this today. It's for $180,000. It's the grant for the public safety, and it's on the cyber grant that we received last year. We will hopefully get it again this year, but I do need action to change the budget. Or we are getting it this year. Oh, sorry, yeah. You would sign it. Thank you.
I'll make a motion to adopt court order and budget adjustment number 4 for $180,000.
I will second. All in favor?
Aye.
Aye. Okay. Health Department to discuss a copy machine capital purchase.
Good morning. We're having issues with one of our copiers. It's kind of double printing words and it's really hard to read. We tried to call for a service, but it looks like the company had dropped the service contract, but it's from like 2016. It's an older copier. So we want to use some of our our epidemiology for
I
public
was moving stuff.
laboratory capacity contract to purchase a new copier. Brian got us a quote for it, and then we decided to just do the cost per copy instead of paying the monthly copy fee, because that's for a certain amount, and we don't know if we'll use that amount, so we just want to try it this way. So the purchase of the copier is $3,076.65.
I'm good with that.
Yeah, that's fine.
You need We don't have a contract or anything.
It should be.
Oh, yeah, accepted.
Yeah, as long as Brian.
Brian says it's fine, so.
Don't look at me, I didn't say nothing.
We'll just, no, ELC. We'll take it out of ELC.
Probably.
Because we use it again in the clinic, so.
We're gonna have to start dressing you in white. You know, so pure,
Get you a
whatever
halo.
Brian said. That close to.
I'll make a
Don't
motion
put that in the newspaper.
to purchase the NASPO Canon copier for the health department at a cost of $3,076.65.
I will second that motion. All in favor?
Aye.
Aye. Okay. Discussion of care leave policies. Our esteemed collector, chairperson of our care.
The Care Leave Committee met last Thursday. After the commission meeting, we decided it might be a good time to review our care leave policy to at least temporarily be able to offer something for parental leave that the county currently doesn't offer in its listed benefits. And we met for actually probably the longest meeting we've ever had that I can recall. Discussed it quite fervently and came up with a recommendation to allow up to 6 weeks of care leave for that type of, for pregnancy benefits or parental benefits. I forwarded those to you. As I understand, the commission has some suggestions for some other changes. I feel that the committee needs to get back together again to review that before we sign off on it anyway, even though you all have to make the ultimate decision. Regardless, though, the goal of it is to allow up to 6 weeks of parental leave for those employees that don't qualify for FMLA. And this program, for us, we said would start March 14th when we met and run through the end of the year, December 31st. That would be to allow the commission time to research and review and look at making possible changes for the benefit of county employees to the benefit program for county employees.
Yeah, I guess it's time to adopt a policy so we can insert it into our employee manual, so, thank you.
So our original intent was to come this morning and provide this for you all for your approval. And again, as I understand, Jill has forwarded some minor changes to some of the wording in the policy for care leave. And as I said, we'll try to meet again maybe this week, hopefully, to review those, and we can bring it back next Tuesday for approval by the commission.
That all sounds good, Larry, and Jill and I spent some time yesterday wordsmithing, I guess is maybe the term. It wasn't to dramatically change what the care leave policy change is proposed to be. So I got a few comments to make about it. Parental leave, you know, I'm a strong yes on that. And how do we get there? Well, it looks like it's going to be a two-step approach. The first approach is to modify the care leave policy to take care of us from now through the end of the year. I think we're all on the same page, and it's parental leave includes adoption issues or circumstances. And the one that then we will adopt will be modeled, I think, on Executive Order 1709 that the Governor Crichton's issued back in 2017. Now, when you read into it and look a little closer at that one, it was for the governor's employees, and not for judiciary, not for legislature, not for any of the elected officials, although they were encouraged to adopt it. So as I looked at that, I'm a little, not nervous at all, but the commission adopting a policy that is imposed upon the collector, the sheriff, the prosecuting attorney, I know how several of them feel about it. I know how the prosecuting attorney feels about it because his folks are the ones who brought this up. I know how the public administrator feels about it because he has gone on record publicly about it. In a way, I don't care what health thinks about it. I do care, but it doesn't matter because you're not an elected official. So what I'm saying here is I'd like to hear from the elected officials who haven't raised their hand and said, I want this in my elected official office. Just like Greitens couldn't tell the legislature what to do, and he couldn't tell the judiciary what to do, and he couldn't tell the state treasurer or the secretary of state what to do, but he encouraged them to adopt the same policy, and maybe they did. So I see us getting there in 2 steps. The first step is about to be taken. The second step would be effective January 1 of next year going forward, which would be a rewrite of our policy. And actually,
ILOA's policy.
and Jill has actually Office of Administration then adopted a policy which we can cut and paste and apply to county officials or county employees.
Sorry about that. Okay.
I think we're on board with that. And it's fair to take it back to your group when we sort of wordsmith it to death, I guess, and then get your blessing.
And that's what we'll do.
Yeah.
And it's just the committee's bylaws to bring the recommendations to you guys. It is your policies, but you guys have been very gracious to the people that are
Yes.
thinking long and hard about this, so.
One of the things it could boost, I think it would boost the contributions to the Care Leave bank of hours that exist when folks learn, oh, you mean if I gave some of my unused vacation hours to this bank, it might be used by a expectant mother or a couple that are adopting. Could be one of the positives of it.
Well, certainly our Care Leave program wouldn't be what it is without the generous contributions of the county's employees that have contributed their excess vacation hours or hours they may lose to the program. And that's what has made it such a great program for county employees. And we always encourage them to consider that, especially if they're going to lose hours at the end of a year that they weren't able to use vacation-wise. So
Yeah.
from my point of view, the committee can't thank the county employees enough for their generosity.
Our employees are the county. So I don't think Harry meant that he didn't care what the health department, our EMS, all of our whole family of Cole County employees, this affects, and we do care about them. I think at one time, a couple of years ago, did we have 3 nurses who were pregnant? I mean, we can't lose 3 nurses, and we didn't have this, and we didn't lose, but we need to address this so that this doesn't happen again.
As we kind of drilled into it a little further, Chief Hoy of EMS weighed in with some experience that he, as his spouse, is an employee of the Veterans Administration, and so we got a little more info on how VA administers that program with them. And one of them is, which I think we try to drill in here a little bit, is if someone takes the weeks and doesn't come back, that needs to be an issue that's addressed. So they've addressed that by, if you take 6 off, you need to come back at least 6 at the end of the 6, rather than just take the 6 off and never come back.
And I think we have something similar to that in
You do,
this.
Yeah.
right?
I had the federal policies too.
Okay.
Well, thank you.
We'll
for-
try to
for-
meet this week
Yeah, we
and
need to keep moving
get
ahead.
back to you for the next Tuesday's meeting if possible.
Thank you, Larry.
Thank you all.
Okay, we are going to table the discussion of the data room at the Pringer Family Center. So we have approval and signing of the Civic Plus project timeline.
Okay, well, this is actually gonna be an electronic signature, so I will need, just your approval so that I can, as your representative, sign
Sign
the,
Sam's name.
the agreement. They have sent us the timeline for our project, and the dates are set, so, this is just so they have resources that are reserved, so if we, at the last minute, or, you know, not within a decent amount of time, decide we want to cancel one of these dates or change something date-wise. This is just saying that we will pay them for their expenses, that they've had to rearrange things. So if you approve it, then I'll go into the form and go ahead and approve it there.
I see the number 1,000 and the number 500.
Yeah, not to exceed 1,000. That's if we cancel or reschedule within 0 to 13 days would be a not to exceed 1,000. If we cancel or reschedule within 14 to 20 days, it's not to exceed 500. And then up to 21 days, you're not charged.
Okay. Okay.
I'm fine.
I don't foresee any issues with us being able to meet any of the deadlines.
So would you like a vote on approval? I'll make a motion to approve and sign the Civic Plus project timeline agreement.
I will second that. All in favor?
Aye.
Aye.
And if I could ask the department heads and elected officials to please ask your employees if they're out and around, or if they know of some really beautiful areas of the county that they can take some pictures. We are gonna need 15 to 20 pictures to choose from, landscape, orientation. I've been trying to look for places to take pictures, but I'm not out in the county like a lot of other people are, so other people know more places than I do. So please ask them, we're really in need of pictures.
Okay.
So we also have something on our website and our Facebook page for the public to submit pictures, but we haven't gotten anything. So.
Okay.
All right.
Boy, we breezed through that really quickly. Do we have anything else to come? Yes, please, yes.
So, as you know, we contracted with the Missouri Center for Public Health Excellence to assist us with getting it accredited through the National Public Health Accreditation Board. So, right now we're working our community health improvement plan. So today we're having a stakeholder meeting at the health department of the community partners that will help us with our priority issues, which are mental and behavioral health, access to care, and chronic disease prevention. So I just thought I'd mention that it's going to be from 11 to 1 today. We've had quite a few RSVPs, so we're looking forward to having that meeting. Most CFI's going to be there to facilitate it. We have some objectives and some strategies laid out, and then hopefully our partners will contribute and talk about the strategies that they do that will contribute to our objectives so we can meet our goals and work on improving our community. So it's kind of the next step in our process on the road to accreditation.
Anything else? I would entertain a motion to go into closed session.
Always try to entertain the presiding commissioner. So, pursuant to section 610.021 of the revised statutes of Missouri, the commission will go into closed session to discuss the following: personnel issues under 610.021 subsection 13.
I will second. Roll call, please.
Sam,
Yes.
Harry.
Yes.
Okay.